So welcome everybody. Particularly pleased to be able to welcome back Professor Heather Taussig from the University of Denver and the Kemp Center, Colorado. Heather, we've been very lucky to have Heather with us earlier in the year on a Fulbright scholarship, and it was great to hear more about her work. Today, she's going to talk about the research that she's been doing with young people in foster care, and she's been following their trajectories subsequently in a longitudinal study, and she's very much going to talk about the outcomes and findings from that. So thank you very much, Heather. Just to say, if you've got questions, if you put them in the chat at the end of Heather's talk, we'll pose them then, and she'll be able to respond to your queries. So thank you and welcome, Heather.
Thank you so much for having me and inviting me to participate in this very important conference. As Allison said, my name's Heather, and I am originally from Colorado, and very, very excited to be participating in a Cascade Exchange event, because I connected with so many folks when I had the privilege of being in Cardiff from April through August. My co-author on this study is Michelle Munson, and she is at NYU, New York University, and teaching a class right now, so is unable to join our presentation today. So as Allison said, I'm going to talk about a longitudinal study of young people's perceptions of being placed in some type of out-of-home care, and we'll get started. If the slides go forward, let's see. There we go. So of course, this takes a village to do this kind of work, and we have many people to thank, primarily the children and families who participated in this work, as well as collaborating agencies and funders. Recently, there was a call to action to change child welfare conference that was hosted by the Kemp Center, of which I am an affiliated faculty member. And both here and I believe in the UK, here in the US, we have been talking a lot about how we want to either revamp, retool, or dismantle and rebuild the child welfare system. So there's a lot of calls for change. And, you know, and a very important voice at the table is young people themselves. And this study aims to hear their voices and be responsive. So the research questions of this study were, how do children ages 9 to 11 feel about being placed in some type of out-of-home care? Was it helpful at 9 to 11? Did they rate it as helpful, difficult, both? If they had never been placed in out-of-home care, how would their lives be now? And how do they feel about the amount of information they get from their caseworker? Do they have enough to say about what happens to them when they are in out-of-home care? And how do these same participants now in young adulthood answer these questions? How do their responses differ as a function of demographic differences, placement characteristic differences, mental health functioning? So those were the main questions we were looking to answer. And then we got open-ended, or what we call qualitative responses from young adults on how they would suggest changing the child welfare system. Our study participants included children ages 9 to 11 who were living in any type of out-of-home care in participating counties in Colorado. Over 10 summers, we recruited them, and there are 215 in this current study. They had to be placed in what we in the United States call court-ordered out-of-home care following a dependency and neglect petition, so become wards of the state. And that had to have happened within the prior 12 months. So we are interviewing children who were more recently placed into out-of-home care, not those who had been in out-of-home care for, let's say, 4 years. On average, these young people had been in care for 6 months. And we conducted confidential one-on-one interviews with them, typically in their homes when they were in pre-adolescence, and then again with same youth in young adulthood. So it was an average of 9.5 years later, and we had an 89% retention rate. So in large part, these young adults were representative of the children we interviewed about 10 years earlier. And young people continued to participate in our study, even if they changed placements, reunified with their parents, were adopted, or emancipated, which you, I think, call care leavers in the UK. In preadolescence, the average age was 10, and in young adulthood, the average age was 20. About half of the sample identified as female. There was pretty good racial ethnic distribution among the sample for the United States. So about a half self-identified as Hispanic, about a half as white, 29% American Indian, a little less than a third African American, and fewer Asian or Pacific Islander. As you might imagine or could figure out, these numbers don't add up to 100%. So young people could identify more than one racial ethnic identification. The vast majority of young people had court-substantiated neglect, about a quarter physical abuse, and many fewer sexual abuse. Again, this is from court records and caseworker reports, as opposed to self-report of abuse and neglect, which we also have from young adult interviews. In terms of the care experiences these young people went through, at baseline, at the first interview, about half were in kinship care, a little less than half in non-relative foster care, and a small minority were in residential placements or group homes. In young adulthood, we asked, did you ever live with kin? Almost the full sample had some experience living with kin. 3/4 had been in foster care, non-relative again. Over half had lived for some time in congregate care. 45% experienced reunification with their birth families throughout the study. That doesn't mean that they weren't removed at another time point as well. And again, about a quarter emancipated from care, so turned 18 or could be younger and was a care leaver. About a third had a termination of parental rights, which means in the United States they can be legally adopted. And 3/4 of those who had termination of parental rights were eventually adopted. But there was a lot of adoption disruption, as you can see. 40% of those who had termination of parental rights were placed in an adoptive home, but the adoption was never finalized. And a small percentage, 16% of those who were adopted were removed from the adoptive home after the adoption was finalized. All right, so what do you think? If you want to put some thoughts in the chat box, we would be excited to hear your thoughts before I present the findings. If not, I'll continue and we can talk at the end. But what do you think our results say? How do children ages 9 to 11 feel about being placed in out-of-home care? Do you think they felt it was helpful, difficult? If they had never been placed in out-of-home care, how do you think they reported their lives would be now? Better, worse? So I'd love if you would take a minute and just put your thoughts about how you think young people who, again, were recently removed from their homes and placed into care might answer questions about their thoughts and feelings related to placement.
Okay, so Zoe has posted a comment. Mixed feelings about being placed in out-of-home care. Some probably found it helpful, and others may have had more negative feelings about the placement. Annabelle's also said both, and I was just busy typing myself, so I was going to say I think they might have been positive about going into placement.
Okay.
So,
great.
And we've got Maria, who's saying, I'm hoping they would have found it helpful in the long run.
Okay, wonderful. Sorry, gets tripped up, I think, when we stop here.
And Colin has just said, lovely to see you, Colin. Difficult for them to say, perhaps, in the first 6 months.
Right. So again, we asked them early on and then about 10 years later. So retrospective reporting of what that experience was like. We also asked them how they felt about the amount of information they got from their caseworker, and did they get to have enough say about what happened to them when they were in out-of-home care or while they are in out-of-home care. So again, all the 9 to 11-year-olds were currently in out-of-home care. And then, as somebody already responded, in young adulthood, do those answers change? And again, I'll show you our findings. So how helpful was it to have been placed in out-of-home care? So here on the left are the pre-adolescent responses, and on the right, the young adult responses. And just by glancing at the colors, you can see that it didn't change very much in terms of the responses between pre-adolescence and young adulthood. So about 40% said it was very helpful to have been placed in out-of-home care. About the same percentage at both time points said it was somewhat helpful, and a minority reported it was not at all helpful to have been placed in out-of-home care. And then we asked, how difficult was it to be placed in out-of-home care? Sorry. There the numbers change a bit between pre-adolescence and young adulthood. As you can see, in pre-adolescence, 20%, so 1 out of 5 is saying it's not difficult. By young adulthood, only 9% are saying it was not difficult. So the adults are reporting more difficulty associated with being placed in out-of-home care. And also the reports of very difficult were higher in young adulthood than in pre-adolescence. And then finally, we asked, if you had never been placed in care, would your life be worse than it is now, the same as it is now, or better than it is now? And again, young adults reported that life would have been worse than it is now at a greater rate, over half of them, than if they had never been placed. And only 12% that reported that it would be better than it is now, versus 42% of pre-adolescents saying life would have been better had I never been removed. So summary of these findings, again, over 80% of participants at both pre-adolescence and in young adulthood reported that it was somewhat or very helpful to have been placed in out-of-home care. And although 1 in 5 preteens felt it was not difficult to have been placed, that number dropped to 9% by young adulthood. 20% more young adults than preteens reported it was very difficult. And although 42% of preteens felt their lives would have been better had they never been removed, only 11%, again, these are the same participants, reported this in young adulthood. Okay, back to the chat box. I'd love to hear your thoughts on who might answer these questions differently. Do we think there might be differences in appraisals of out-of-home placement based on gender, race, ethnicity, type of maltreatment that they experienced, type of placement, and whether that was at baseline, at pre-adolescence, or over time, whether or not they reunified, emancipated, or adopted? Do we think young people with more mental health challenges would appraise this differently? And do you think their time 1 appraisals, again, in pre-adolescence, would predict young adult appraisals? So back to the chat box, if you have thoughts, and Allison, if you'd read out any responses.
Yep, will do. So Laura, well, first of all, before that, Carol just noted that people would have possibly felt sad, going back to your previous question, but actually helpful when they look back, they could see, more benefits of that. And
right.
Colin noted that blood sometimes runs thicker than the care system. And in terms of the questions that you're asking now, Laura has suggested that 3, 5, and 6 might have been particular factors. And Sarah has suggested that she thinks the placement type and location, as well as reunification, adoption, etc., would have probably the biggest impacts.
Okay. Any guesses from you, Allison?
What do I think? I think 3 and 4. 3 and 4, I think.
Okay. So we're hearing maltreatment type, kind of placement, reunification, emancipation, or adopted. 3, 4, 5, and 6 are our best guess.
And a couple more comments, they're flying
Yeah.
in now, so sorry, I'll
Great.
try
No, great.
trying to keep up with them. Zoe said female participants might have reported less positive feelings towards being removed than male participants at pre-adolescence points. Carol Flores has said a lot would depend on really how settled they were in the placement. Maria said, I think as an older person, you would think more about the question and think the placement would make all the difference. And Annabelle Morgan has said there's a lot of stigma still for young people identifying as care experience, sadly, and I think it would depend on support and issues. So 3, 4, and 5 would all impact. And lastly, whether people were separated from their siblings, brothers and sisters.
Super. Well, those are great thoughts, and you can keep them coming. I love the sort of what else, because I think some of those responses do speak to what else we should be looking at. Siblings, for sure. I'm going to talk about that in a bit. And also, maybe, again, how settled they feel in their placement, how attached are they to their caregivers. We actually published a paper that I'm not referencing today, but I'm happy to send it and you could post it because this one is not yet published, this study, but we did just look at responses in pre-adolescence, and we did look as a function of attachment to caregiver. And that was more of a strong predictor of responses to these questions, as you might guess, than some of these external factors potentially. So I do think, feeling attached and happy in their current placement. But we often make presumptions too. I mean, I don't know if you do this in the UK, but in the US, we say a young person, let's say of color, maybe an African-American child who's placed with a white parent would feel a certain way. Or maybe if you've experienced sexual abuse, you're going to be more likely to report being placed as positive. And being placed in a residential facility, we would assume would maybe make you more negative about being placed, etc. So there are a lot of presumptions, and we don't often ask young people what they think and then look at whether or not our assumptions are correct. So that's what this study aimed to do. So we dichotomized responses. So we looked at would life be the same or worse versus better than it is now. And again, there was only 11% who said that in young adulthood. But in order to clearly look at the predictors of the responses, it was easier to make these two categories. So in looking at what predicted the same or worse versus better than it is now, in pre-adolescence, excuse me, their appraisals of being placed were unrelated to all of the things listed here. So most of the things you all identified. And again, we didn't in this study yet look at attachment to caregiver, but demographic and placement characteristics. We have a measure of adverse childhood experiences as well, trauma symptoms, young adult mental health, later emancipation or reunification. None of that predicted responses in pre-adolescence. But there were two things that were related. One, older youth were more likely, again, still in pre-adolescence, to rate that life would have been the same or worse had they not been removed. And subsequent adoption. So those young people who reported that life would have been the same or worse were more likely to have been adopted. In young adulthood then, appraisals of being placed were unrelated, again, to some more demographic characteristics, type of maltreatment, emancipation, reunification, or adoption. So that's interesting. And ACEs, these again were measured in pre-adolescence. But there were more things that were related in young adulthood. Being American Indian, so American Indian young adults reported 95% of them said life would have been worse, same or worse, had they not been removed. And there's a lot of work being done in the US to try to place American Indian children in their tribal communities, if that's appropriate, and with relatives. So it's an interesting finding. And then mental health symptoms, and similarly a related piece, life satisfaction. Those young adults who reported more trauma, depression, and lower life satisfaction were more likely to say life would have been better had they not been removed. So whoever guessed mental health earlier gets a gold star. So any reflections that you want to put about those findings in chat before we move on? Give me a second to look at time. Or any questions or clarifications? I know we'll have time for questions at the end, but if there's anything about that before I move on, happy to respond.
No, there's nothing in the chat at the moment, Heather.
Okay. So then we looked at agreement between how young people appraised out-of-home care placement in pre-adolescence and young adulthood. Did what they say, again, early, predict later. And there was a statistically significant finding that early reports predicted later reports, but I'm just going to show you the percentages here. So only 7% said better at both time points, and similarly, only 5% said life would have been the same or worse at both time points. There was some flip-flopping where they said better in pre-adolescence, and then life would have been same or worse had I never been removed. That was a third. And the vast majority, though, said life would have been the same or worse at both time points, over half. Then we looked at, do any of those factors that we looked at before predict group membership, being in one of these four groups, picking better, better, same, worse, etc., to same, worse at both time points. And none of the variables predicted group membership here. Then we asked the young people, how do you feel about the amount of information you get in pre-adolescence from your caseworker, or in young adulthood you got from your caseworker? And in pre-adolescence, a third of young people felt they always got enough, but by young adulthood, this same group of folks said only 20% said that they always got enough information. And not at all enough then grew the percentage by young adulthood. Did you get to have enough say about what happens to you while you're in out-of-home care or when you were in out-of-home care? And these percentages were almost identical. And it's really telling that the young people, almost half of them at both time points, said they almost never got to have enough say about what happened to them while they were in out-of-home care. And usually is, around a quarter at both time points. So in young adulthood, we then asked participants, if you could change the child welfare system, what would you do? So these were open-ended questions that came at the end of a lengthy, more quantitative interview where we asked them all kinds of questions about thoughts and feelings and services received and attachments and social supports. And so we have other papers pending actually on some of those data that we have collected. But at the end, we opened it up and asked questions such as, how do you define family? Which Allison, I, and another colleague, Louise, are working on a study coming from that. And as part of this, we asked, if you could change the child welfare system, what would you do? And we had a whole continuum of responses, as you can imagine. About 15% of participants actually said nothing. It seems fine as it is. And then we had fewer who said everything. Many of the responses were much more nuanced, of course. But here are some responses that are sort of on this nothing to everything continuum. And a bunch of don't knows. I have no idea, so I don't even begin to understand all the stuff that goes into it. So I don't really have an answer to that one. Somebody else said, I don't know. Honestly, I don't think that it needs changing much. I wouldn't do anything. Someone else said, I wouldn't change nothing about it. It was nothing wrong with it. And again, on the other end of the continuum, I'd change it all. We then took the more detailed responses and categorized them into three main areas. Using sort of Bronfenbrenner's framework, youth and family responses, things that needed to change at that level, at the caseworker level, and then at the system level. And young people's responses often included, again, changes that were needed at every one of these levels. So within youth and family, the themes that we pulled out of the young people's responses were youth voice, education and support, and maintaining youth connection to family. Here's some examples of youth voice. When I was growing up in foster care, they always told me what was better for me, but they never asked me what I think would be best. So just pretty much asking the kids what they want instead of just thinking what they think is best for them, because they're not always right at all, you know. I'd let them have a little bit more control in what happens. Give the kids like more options. In terms of education and support and preparation for the future, teaching foster kids a lot more than what they're taught right now, because I think that I was really prepared when I left out of home care. But a lot of my friends, or like younger youth, are not as prepared as I was. And I think that if we had more hands-on as far as going to find a job and had more mentors and more support, then there wouldn't be as many homeless youth as there is right now. And there would be more people in college and more people with good jobs, more education and more support, particularly hands-on support. Another participant said, we need better help kids set up for their future, like so that when as soon as they turn 18, they won't just be thrown out into the world type thing. And finally, they said young people need more education and support and guidance. I think that part of it was that I had a small group of people who cared about me. So it was nice to find someone who I could express myself with. And I think for people who are still kind of adjusting to being in situations like mine, I think that would be important, finding kind of either a mentor figure or a mentor that can kind of encourage and guide them from a life that's better than which they came from. And then maintaining connection to family came up a lot. And the sibling piece, we have actually twice in these themes because it was so prevalent. I was completely cut off from my birth family, and I didn't mind so much being cut off from my mom. I knew why I had to be. But being cut off from my brother, my grandmother, when they weren't doing anything wrong, that was tough. You know, because people can pass away, people can end up in the hospital, things can happen. It's at least nice to know if one of your family members is not doing well, or at least where they are in life. And then make sure siblings stay together, because being apart from them, that's probably one of the hardest things. Themes about what caseworkers could do to improve the child welfare system. In the training realm, personal connections were really suggested as being important by these young adults. An example is the caseworkers and the social workers really don't make personal connections with the kids. I think it was my social worker. The only time she ever started to talk to us was when we started asking her, how come you don't come around when you're supposed to? I thought she was supposed to get to know us and help us through this. And she was like, okay, you know, I mean, she eventually started coming around and taking us to McDonald's every once in a while and talking to us about that. But that was towards the end when everything was going to shit. Caseworkers should also spend more time communicating, according to young adults. Have more time for, wait a second, make more time for each kid, for each foster kid. Make sure everyone has the attention they need and when they need it most. Just in general, like, I don't know, give every kid the attention they need. I never even knew my caseworker or anything like that. She never questioned me. I never got any kind of, you know, you've been displaced. Do you want therapy? Do you want this? Do you want anything? I never got any. It was just like, well, you know, here you go. So I would definitely change that. There needs to be more communication overall. And I want to pause here for 1 second, because I do think one of the important things here is that we're interviewing young people who, aren't necessarily identified by the child welfare system as needing a lot of support. And I worry a lot in our work, and maybe you do too, that young people who aren't displaying mental health or behavior problems that are being identified by their foster parents or teachers get sort of lost. And so it's important that we're also talking to young people who aren't necessarily coming to the attention of adults to ensure that they're getting the services and support they need. So spending time communicating with young people, regardless of whether, again, it seems like they need attention or might be doing okay. And then helping families and parents more is another theme. Address the root of the problem. I would change actually giving the parents, more tools so they could get their kids back, and not just so quick take them over, say, missing a visit or something. Actually work with them. Don't just try to push them off to the side, because that could damage the kid in the long run. I mean, they should help the parents more before they take the kids away, or at least try. Yeah, like more resources, like how they have food stamps, well, stuff like that for parents who are struggling with their kids. And then from a system theme, which relates obviously to caseworkers as well, chances and leniency were brought up, quality of care within system, importance of placing siblings together, that is a typo I see, and more visitation while in care. So again, building on giving parents more support, this is let parents have a chance. Even though parents mess up once in a while, they deserve another opportunity. My mom didn't get hers until she passed away. Give the kids' parents another chance to prove themselves to be a better person. That's what I would do. Give the families more chances before removal. And another participant said, I would have a little bit more leniency on families because they took me from my parents, me and my sisters and my brothers. And it was all off of assumptions and false information that they were receiving from whoever they were receiving it from. Young people also called for better screening, interviewing of foster parents, background checks. I would change how we interviewed our foster parents. I would change that because we need to know if our foster parents are doing these kids that already been done wrong right. We can't just move the kids that been done wrong back into something wrong. And sometimes that happens to the foster kids, making sure we have a thorough, stricter background check on our foster parents. Another participant said, better interviews for parents and making the interview harder for foster parents to get in, because a lot of people use foster care as just another paycheck and they don't give a damn about the kid that they're bringing in. More visitation was also mentioned by many participants. Probably give them more visitations to the parent, like if when they're in a foster home, or have them get more visitations with their family. I feel like I would involve more visits because I feel like it wouldn't have been as bad as I experienced if I had been able to see my parents a little bit more, because that was the main problem. Because every time I had left the system, left the building where you visit your parents, I felt disconnected and alone afterward. And I felt that did cause a little bit of stress and sadness, a lot, that I felt like every time I'd be able to go home with my parents and I wasn't allowed to. That also speaks to sort of false expectations and probably getting, again, enough information from your caseworker. And finally, this piece about siblings. This is throughout all of the narratives we received in response to many questions. The splitting up of siblings. I think that's what I would change, that they could stay together depending on if they get along or not. Because if they don't get along, you don't want to keep them together. But if they're the only thing that each other has, I would keep them together. And another one, I tried to make it so when families or children get taken from their parents or whatever, that the siblings stay together in the home. When removed, that siblings stay together. So any reflections there? We still have a few more minutes before we'll open it up to questions, but if you have any responses or questions regarding open-ended.
There's a few comments already, Heather. Laura's said, you know, how it's very powerful to hear, thank you. And Carol has said, you know, there's a recurrent theme with care leavers. I've heard it a lot. I knew that I was just there to pay the bills, about the comment about the paycheck. I think she's picking up there. I suppose, you know, my reflection is about the importance of relationships, really, both with, you know, from what you've said, both with siblings and with social workers, with care workers as well.
Yeah.
I don't know if there are any other reflections from people that they want to post in the chat.
Yes, please continue to share. As you do, I will say, and one of our challenges is, how do we measure, you know, connection to siblings, living with placement with siblings? So these young people experience many changes in their lives between 9 to 11 and, you know, 18 to 22. And at each time point when we interviewed them, there were about 5 time points they could be interviewed. We asked about their relationship with their current caregiver or parent. We asked about if they were living with their siblings. We asked about visitation. We asked about attachment. But when you look at, you know, how that influences young people's perceptions, do you average those things over time? Do you say if they were ever placed with their siblings or ever placed apart from their siblings? So because young people's in care's lives are complicated, it's really hard to think about, you know, the influence, let's say, of attachment or parenting skills or strategies, because parents change and circumstances change and people in their lives change. We do have reports in young adulthood of who was the most helpful and supportive growing up and what kinds of support young people perceived these adults as having. We also talk about we ask questions about if they have continued contact with their caseworkers since emancipation, if they have continued contact with prior carers, foster parents, kinship caregivers, and birth families if they never reunified. So we do have a lot of data on that from young adulthood, but partly you'd want to know this throughout the study over that 10 years.
There's a few more reflections here, Heather. I'll read them out. I agree that they may need to leave the person who isn't looking after them, but what about the wider family? And those relationships are important. Yes, I agree, relationships are key, communication and listening. It's great to have this hard evidence that young people are asking for more meaningful relationships with their workers. We as workers want to offer that, but it's difficult when paperwork takes over. Building relationships needs to be allowed and to be a priority. And Carol has said it seems that the older group were more dissatisfied. This could be because the younger group were not as at a developmental stage where they're able to reflect on their experiences. So, all
great points. Thank you. All right, I'm going to finish by just sharing some summary and limitations of the study and future directions, and then open it up for, again, more reflections from you all and certainly questions, hopefully, that I can answer. So we see the strengths of this study is that it's the first known study to ask children who turn into young adults about their perceptions of out-of-home care at multiple time points, the same youth. We included both closed and open-ended questions, so those that could be rated and those that could be answered qualitatively. And these questions were asked by interviewers, and the young people knew that the interviewers were not connected to the child welfare system and that their answers would not be shared with anybody. This included perspectives of young people with diverse child welfare experiences. So as you can see, if you remember from the statistics, about half of them went home at some point, reunified. Over half were in congregate care, about a quarter emancipated or were care leavers. And so there was very diverse child welfare experiences being represented by the young people here. For us in America and maybe in the UK too, we tend to get perspectives of care leavers, but not younger people who've experienced care, and certainly not young people who've reunified. Typically, it's harder to keep them in research studies. So we feel proud of our efforts to do that and have their voices represented as well. And then we included perspectives of those, again, who might not typically have a voice, younger children, and those who might not feel comfortable sharing their perspectives in a larger forum. So we, similar to Cascade Voices, is that correct? We have a young adult advisory board. And in Colorado, where I am, we often have young people showing up at forums because they're asked to share their experiences. And part of the problem is that not all young people feel comfortable in that public forum sharing their experiences, especially if they're in, let's say, a home where they don't feel super comfortable attached to their caregiver right now. So in order to, I think, get a wider variety of young people's perspectives, it's also important to hear from young people who don't feel comfortable going to these more public forums and sharing. Not that those aren't valuable as well. Of course, there are limitations to this study. We started data collection on this in 2002, and a lot has changed. And we hope a lot has changed, and some for the better, right? But as somebody reflected here, we still hear from caseworkers that the paperwork requires them to spend less time with young people, creating those kind of relationships that caseworkers want to create with young people and feel will be really beneficial. And that young people clearly crave and value. This is a US-based study. I'm talking probably to most people in the UK, and so our findings might not generalize to the UK, but after spending several months in Wales this summer, I do think that there are a lot of similarities in our system and the young people's experiences, more importantly. In pre-adolescence, it's possible that even though this was a confidential interview and we said we wouldn't share their findings, they might have felt concerned about sharing thoughts and feelings, thinking it could have some consequence, although you can see that there was a diversity of perspectives on being placed in out-of-home care. And in young adulthood, how you're doing now, so, depression, for example, and lower life satisfaction or quality of life were related to feeling like life would have been better had they not been removed, could be a function of your current mental health functioning, how you're remembering things from when you were younger. And these qualitative questions, as I said, came at the end of a lengthy interview, and they were part of a series of open-ended questions that we asked. So we coded these qualitative responses without referencing the young person's responses to the other 15 qualitative questions, which is not probably best practice from a qualitative research standpoint. And then this is what I want to hear from you about again as well. There are many other potential predictors to examine. So placement with siblings has come up, attachment to caregiver you all identified. We know that that's probably really important. How about experiencing other adversities over time, other ACEs that may also influence perceptions of care? But some takeaways: it's important to ask young people about their thoughts and feelings regarding their and their family's child welfare involvement. It's important to ask diverse people about their experiences, and don't presume to know what children think about placement in out-of-home care. And don't presume that a child with certain characteristics or lived experiences will feel a certain way about child welfare's involvement. Young people's feelings may and likely will change over time. They may have complicated feelings. That's the title of this talk. Feeling both that child welfare intervention was helpful, but that it was also very difficult and that they didn't have enough say in what happened. But they were able to identify tangible youth, family, caseworker behavior, and system changes that would have made the process of child welfare intervention better for them and their family. So there's some key takeaways here, and their suggestions are really in line with efforts to provide more upstream support to families, certainly in the US, and I imagine as well in the UK, to reduce removals, to provide family support so that they can stay together. And so we are continually talking about how to meaningfully involve young people of diverse background and experiences who have diverse opinions in our efforts to change the child welfare system. So I will stop there. Here is my contact information as well as my co-authors, and would be happy to take questions. I'll leave this up for a minute.
Okay, we have a few sort of comments here, probably rather than questions, but Carol has said that she thinks the findings do generalize. And then Sally has said it says something deeply worrying about all of our international care systems, that children are having to beg us for time with their own families, and that this is not an automatic arrangement. This feeds completely into the feeling that so many children express that removal is punishment for them. And it's not hard to see why they feel like that. And I would agree that having hard evidence is a powerful platform from which to start meaningfully changing the culture. Thank you.
That's a beautiful comment. Do I get to get that as a, you send that to me afterwards? Thank you.
I think Rhian can save them all and we can send them all to you. Colin has said from personal and professional experience, I know Colin, you know, has also been a foster carer, positive relationships between foster carers and birth parents of the children in foster care homes can be really important for children. So that relationship between birth family and foster carers is really important. And I know, you know, you've worked with that in Fostering Healthy Futures, haven't you?
Yeah.
Particular. Now, I wanted to ask you a question about your reflections on the feedback from the Indigenous population. If you'd, you know, what you really made of that, because it's sort of counterintuitive almost, isn't it? Or
yeah, no, I think that's a really good question. You know, we're looking, I'm going to just stop share, at a lot of different outcomes for young people, and American Indian population is seeming to be at greater risk among young people who are all at risk, right? For outcomes including suicidality in particular, unplanned teen births, mental health outcomes as well. So it could be a function of that, you know, them being at greater risk, but, you know, they, as the Black population in the US, have experienced systemic racism and institutional racism for many, many years, and being cut off from, you know, their communities and in some cases tribes is incredibly traumatic. So the compounding of trauma, both historical for this population as well as then with child welfare involvement, I think can be very detrimental.
okay, thank you. Yeah.
But your question was really sort of the paradox, because then why are they saying life would have been worse if I stayed at home? And I think that may relate then to the circumstances of families and communities that are suffering a lot. So I think it is something interesting to dive deeper into, because it's sort of, you know, if you're getting removed and placed in a place that's not feeling safe for you or positive, then why are you saying life would have been worse had I not been removed? So I think it's something for us to delve deeper and to talk to young people who are American Indian about their experiences.
Yeah, it'd be really interesting, wouldn't it, to do more work on that? Yeah.
Yes.
I don't know if other people have any other questions. I suppose I just wanted to observe, and I know you commented about this, about your retention rates were fantastic. And, you know, an 89% retention rate would seem to be fantastic over that time period. And I don't know if you've got anything more advice for researchers in that sense.
Yeah, no, that's a great question. You know, I feel like, one, we're pretty respectful of young people's time. One, we pay them. We also interviewed caregivers at every time point until young adulthood. And I think we ask questions in a way that demonstrates respect to young people. And so many of the young people say after the interviews, one, I'm so glad you found me again. Like they really feel that they're part of an important study on young people in out-of-home care, that we're valuing their perspectives when we interview them, and that we're asking relevant questions. So we really do get positive feedback from doing the interviews. But also, I think paying young people is very important. And I know with ethics boards, and I feel like maybe more so in the UK, there's a hesitancy to make people feel compelled to do the work due to high payments. And yet, so I'll tell you, we paid the young people $40. It was a 4-hour interview at baseline. And then in young adulthood, it was that was split over 2 sessions in pre-adolescence. We don't sit with them for that long. Maybe it wasn't 4 hours, maybe it was 3 hours. But we did a bunch of testing and other kinds of things. So there are 2 assessment time points. And in young adulthood, we paid them $100. So it's not insignificant. And I do think that that helps retention. And I think it's appropriate for their time and views to compensate. But again, more that they say, when are you coming back again? And we say it depends on funding. And so many of them have said, well, I'll do this for free. You don't have to pay me. But I think that that is a hook initially for getting people interested. And then again, I think our respectfulness during the interviews and willingness to keep confidential, obviously with some limitations, their reports does help us with retention.
Yeah, and I think, you know, having read some of the transcripts, you can feel that people are very committed to wanting to be involved. That comes through in the transcripts, doesn't it? That they have some sort of keen association and wanting to be involved. I'm just looking through here. Is it from a comment here from Zoe? Having examined both the US and the UK child welfare systems, asking you, Heather, are there advantageous aspects of one system that you think should be adopted by the other? Now, that's quite a hard question, isn't it?
I would say that I'm not an expert probably of either system. I do think that we sort of see the pendulum swing maybe in both countries, in that, you know, we go from, if a young person is harmed at home, we say, why weren't they removed into foster care? And then if something bad happens in foster care, why are we taking children out of homes and placing them in environments that aren't safe, and those kinds of things. But I think both countries are focused on doing child welfare practice better. And what better means, it comes from a lot of what the young people shared: giving families more chances, intervening in more upstream ways, ensuring relationships that are healthy or sustained or built with caseworkers, for example. So I think we're at a place in both the UK and the US where maybe we continually are, where we're reevaluating practice and trying to make it better.
Yeah. There's a comment here, Heather, from Carol. I imagine that participating in studies like these gives children and young people agency, and that helps with the feelings of helplessness that result from being in the care system. So sometimes it's actually quite empowering to be involved and give agency.
Yeah, we actually, you know, this is part of a broader intervention study and what is called a randomized controlled trial of an intervention that I didn't talk about today, called Fostering Healthy Futures, which is a mentoring and skills training program. So maybe you'll have me back and I can share our findings from that. But so we often think, so we have a control group who didn't get the intervention and an intervention group who received mentoring and skills groups. And we often feel that the interview itself is kind of like an intervention. Gives people a time to sort of step back, reflect on their experiences, both traumatic and positive. We try to have not all negative kinds of things, and also strengths-based activities that they're interested in, and report on those kinds of things. And I do think it is, over several hours, an opportunity for them to reflect. And I think it is, I don't know if healing is the right way, but I think it does give them agency and feel that their views are important, and give them an opportunity again to think and contextualize their experiences.
Yeah. There's lots of comments thanking you, Heather, in the chat box, which obviously we'll get to you. Annabelle said, thank you so much for such a great, insightful seminar, so valuable and worthwhile. Great it's going to be on Cascade. Lots of people asking for the link and copies of your slides. So Sean is assuring people that they'll be able to access the recorded link as well as have a copy of your slides. So that's great. Lots of thank you so much. This is hugely helpful. So
well, thank you as well. And I'll also send the earlier published paper, which doesn't have as many of the open-ended responses, and hopefully we'll be submitting this for publication in the next few months. So I'll keep you tuned about that. If there are other questions after this, please feel free to reach out. I'm really grateful for this opportunity to present here.
Yeah, well, I'm sure we will get you to come and talk about fostering healthy futures as well. So, you know, I'm sure we'll pick up on that offer. Thank you very much.
Yeah.
Heather,
Thank you so much, and everybody have a great day. Stay well.
Okay, thank you.